I'm Dr. Lester Hartman, and our topic today is going to be the Asthma Management Plan and also how to prevent emergency room visits for asthmatics by following your asthma plan. Remember, this is Westwood-Mansfield Pediatric Associates, and that anything that's said here is pertinent to our patients, and your pediatrician in another practice may have a different opinion from what we have. Today I want to show you our new, approximately 6th edition to our asthma management plan, which we feel is an excellent way to empower parents on how to manage their own child's asthma to save money from the cost of going to the emergency room as well. For example, a copay in our office may be 1/5 to 1/10 the amount you may spend in an emergency room, and if you have a deductible, you could pay a significantly more amount, up to 25-30 times the cost of a copay in our office as well. So let me start out by showing you our asthma plan. This is one we specifically designed and tailored to ourselves based on improvements in the ones that the state uses and specialists use. And we feel this is a superior plan to any other one that's offered. So remember, asthma plans like this have 3 zones. The green zone is for those asthmatics to take medicines, and not all asthmatics need it, probably about 25% do, that need to take medicine on a daily basis to prevent themselves from having an asthma episode, sometimes in a specific season, particularly the fall and the spring are the commonest times. Then below here is the yellow zone. This is when you're mild to moderately sick and you're having some trouble breathing and you're having some coughing, and finally when you're really sick, okay, that you're having really rapid breathing, difficulty catching your breath, things like this. And that's how this plan is laid out. And if you follow our plan using the nighttime asthma attack plan, the purple sheet, heavy stop card, most of the time children do not need to go to the emergency room for asthma if parents read this carefully and ask questions of the doctor to make sure they're clear about what needs to go on. So let's go back to the asthma plan. So here, as you can see in the asthma plan, are all the spaces to fill in allergy medicines and asthma medicines as well. Typically, the mass majority of the time, people can manage this at home. The times that you can't manage asthma at home is when your child is bluish looking, which is rare, or obtunded feeling, which means that they're losing their level of consciousness. Sometimes parents use the term lethargic. Again, we don't always use that term lethargic because it's hard to figure out, but obtunded is like a child that looks confused or doesn't respond to your questions when you ask. The other time is when somebody has a high fever and trouble breathing. That could be a pneumonia and not necessarily somebody's asthma, or it could be a combination of both, and that warrants a call to us. A child who's blue or very lethargic warrants a call to for an ambulance to come pick your child up. In the meantime, though, while you're waiting at all, if you need to call the doctor or us, always start your medicines that are in the red zone in those cases. Always, always give the Orapred, and always, always give the albuterol or ProAir during those emergency times. Never wait for the doctor's call back to start that. Never wait for the ambulance to come before starting that. It's important to start it in advance. You do not need permission. The commonest reasons parents go to the emergency room with their child's asthma is they're not feeling comfortable managing it. And oftentimes, as our nighttime asthma attack plan shows, is we give you Orapred, prednisone or prednisolone, or to have in your refrigerator, if it's liquid, or pills that can last up to a year before they expire, and you can start that medicine. The commonest reasons that parents end up in the emergency room is they're hesitant to give their child the medication when they need it, and they end up going to the emergency room, getting 3 nebulizer treatments and oral steroids. And I've had parents say to me, why didn't you do that years ago? And that's why we developed the nighttime asthma attack plan, so you can do it at home yourself. Occasionally with teenagers, kids who are actually not having asthma attacks are actually having panic attacks or anxiety attacks, maybe because they got slightly short of breath at the time, and it kind of snowballs on itself. So keep that in mind sometimes with your teenagers as well. Certainly if they don't feel like they're breathing well, you need to at least call us if their color's good. If their color is not good, that warrants calling an ambulance. Again, very rare. Finally, there are often times that kids with asthma will cough a lot. They don't wheeze, they don't look in distress, but parents go to the emergency room because they think their child's going to choke to death or have something really serious. And frankly, the emergency room with kids that just cough with no problems breathing in between, in other words, breathing rapidly or being short of breath in between, the emergency room won't do anything more than what you have, which could be a nebulizer with albuterol, or as we put in our yellow zone here, Atrovent, another medicine that's used. As parents, it's not unusual to see them go to the emergency room when their kids are having bad coughing episodes. But the Atrovent may work, or the albuterol may work, and then the other option is to go to Orapred if neither of those worked. But it's very important to realize that you have much more control sometimes than you realize, given the tools that we've given you, between the medications we give you, the equipment we give you, and the literature that we give you. Again, this is the 3-zone plan. Green is when your child is well to prevent your child from getting sick. Many don't need medications, up to 75% don't need daily medications, 25% do, and that's another reason oftentimes parents will end up in an emergency room. One, they choose, oh, my child's been okay for a month or two with their asthma, so they stop the medication, failing to realize that their child's asthma problem, is in the fall every year. And you have to compare the fall of last year to the fall of this year. And remember how they did last year at this time. Because some parents stop their medicine and say, well, my child's been fine for the last 6 months, but it's the winter, the spring, and the summer, and they're doing fine. But then when the ragweed starts again, dust might start up again when you close the house, then their kids get into trouble again. You need to compare the fall of one year to the fall of the next year, or the spring of one year to the spring of next year. Don't stop your child's medicine without informing the doctor what you're going to do. In addition, parents run out of medication, their prescriptions, and sometimes they go to the emergency room for that because they haven't had their child's medicine for a few days and their child starts having trouble. Call us first, please. We can help with that. Everything is available here. We can send things into your pharmacy. You can get it going quickly and save yourself the money going to an ER, and also you may end up having a visit to our office the next day, and that copay is far, far cheaper than any emergency room copay, or if you have to pay through a deductible. This is Dr. Lester Hartman from Westwood-Mansfield Pediatrics, proactive in your child's care, empowering families for well over 50 years. Thank you and have a nice day.